This is Average Joe PT. And we're here like always, aren't we, Skully?
That's right, we're always here.
I know, right? Well, we're going to start something new today, folks. We're going to go over the knee a little bit more detailed, going over the anatomy, I think, this one, and then maybe we might touch on a couple injuries that can happen with the knee, literally from almost doing nothing. So stay tuned. So, Skully, don't you wish you had a knee?
No, I don't need no knee.
Come on. Alright, folks, so let's start with the basics of the knee. I'm just gonna throw you up a picture right here. Boom! Okay? And that's gonna just give you the basic bone structure of the knee. And then obviously surrounding that knee are the ligaments, and the ligaments attach bone to bone. And there's a bunch in the knee. There's also tendons. There's also muscle. There's also this thing called bursa. There's a lot of that in the knee, as well as you got the old fluid in there, in this case synovial fluid in that knee joint. And also in that knee joint are these things called meniscus. And that's where a lot of the injuries are going to come from. They're going to come from either meniscal tear, or if you get hit bad enough in the knee, maybe like a football, or someone being a joke and hit you sideways. That can mess up this knee joint on these ligaments on either side of them. So you almost get what we call this lateral hit, so part of the knee just pops off. Now, with the meniscus, those weird shaped looking things, their real focus and purpose is really just to make these two bones right here, this one and this one, to make them working with one another, or what we call congruency in the fancy world. We just call them make them looking at one another. Now, if you guys have any questions, go ahead and throw a pop down below. Love you to have a ding ding subscribe. Skully and I were here. I got tons of content on here. Knees, hips, shoulders, headaches, anything you can probably think of, I've probably covered it. My earlier topics are all about reducing your pain in the home. I think my next couple topics are going to be like, if I have this pain or that pain, what the heck could it be? So let's start out with this knee. Now let's talk about, let's say it's catching. You're walking, all of a sudden it's like, ooh, that thing just kind of locks up on you a little bit. More than likely, it could be a meniscal tear. And with those tears, what happens is if we just take a piece of paper to kind of simulate what a tear looks like, you're kind of in here, and you see this little piece right here. So let's say you tore your meniscus. Now that's just kind of floating inside that knee joint, and it can catch because these bones move when you move. When they move, you move. When I move, I move. Ain't that right, Skully?
Oh, brother.
I know you don't move at all. He's a stick in the mud. But anyways, these little blue things here, if you look at them at this model, they represent the meniscus. And so if we just look on this outside where my finger's at, and let's just imagine there's a tear on that, and they're inside this knee joint, if I pull this kneecap to the side, inside this joint is what's called synovial fluid, and that's actually what nourishes this tissue inside here. And so just imagine that tear just kind of floating around in there, and all of a sudden you bend it or straighten this knee just right, and it catches. And all of a sudden it swells up, inflammation, instant pain, can't put no weight through it. So that's kind of like the classic, what we call meniscal tear. And they can happen from as simple as just getting up wrong, maybe stepping up onto a stone or something like that wrong, maybe, playing with the kids or doing something outside and you just pivot and hit that knee just right, and for some reason there's a fray in there, and it catches and tears more. So what do you want to do if you have a tear like that? You want to ice it, you want to rest it, you want to do compression and elevation. So that's the thing called the Rice method. You want to do that for the first 72 hours and hope that you really didn't tear it and all you did was just, maybe inflame something in there. But if it seems like it continues on, you're going to have to see your primary care doctor. They'll have to do x-rays and then probably have to do an MRI. All right, and then from there, you know, they might have to do in there and scope it. So maybe my next video, if you guys want to talk about it, we'll talk about what the heck the surgery is. Pretty quick, pretty simple. It's more of an art form than anything else when it comes to what they call meniscectomy, or removal of some of that meniscus tissue. So, like I said before, Skully and I would love to have you guys join. If you have any questions, leave them down below. Subscribe. We'd love to have you. And until next time, Skully and I always like to say, look up and keep smiling. See you next time, folks.